I'm here at the annual meeting of the American College of Obstetricians and Gynecologists, and we're talking about a new procedure called the Mona Lisa Touch. And I'm speaking today with
Dr. Mache Karram.
And you are?
I'm the Director of Urogynecology at the Christ Hospital in Cincinnati, Ohio, and Professor of Obstetrics and Gynecology and Urology at the University of Cincinnati.
Now, the Mona Lisa Touch, exactly what is that?
So it's basically a fractional CO2 laser treatment that's delivered to the vaginal canal and the skin around the vulva. And it's utilizing technology that's been taken from fractional CO2 treatment to the face, the skin of the face and the neck. And just some parameters and probes have been created to deliver it to the vagina, and we're in the process of studying and documenting its efficacy for a variety of conditions.
So we have basically stuff that's been used for a facelift on the face, and we're applying it for, quote, a facelift on the vaginal tissues and the skin outside of the vagina.
Yeah, I don't know if I'd use the term facelift. I think a revitalization.
Revitalization, better term indeed. And what woman's problems, what issues would a woman come to you for this procedure?
So basically the procedure is aimed at correcting a symptom complex that we used to call vaginal and vulvar atrophy. It's now called genitourinary syndrome and menopause. And it's basically the symptoms that up to 50% of women suffer from as they lose their circulating estrogen, specifically vaginal dryness, irritation, pain with intercourse, lower urinary tract symptoms like urgency and frequency, very, very common problems that women start to develop as they lose their estrogen.
And you had mentioned that this was done in a doctor's office. Does it take very long?
No, the procedure itself requires no anesthesia and is done in less than 5 minutes in an office.
Is it painful at all?
It really is not. Most women describe it as a little bit of a vibration. If the woman has a very tight opening and there's any issues with passing the probe, we can use a little local anesthetic gel or cream, something like EMLA or lidocaine gel to facilitate that. But beyond that, it's very well tolerated.
And how long is the recovery?
There's really no recovery. We prevent them from having intercourse for a couple of days, but short of that, they can pretty much do anything they want.
Now, this is not available everywhere, but it is available in certain centers around the country.
Correct. It's been off protocol now for just over a year, and I don't know, there's hundreds of physicians who have acquired this technology. You just need to find a gynecologist or a urologist that has the ability to deliver it.
The skill set and the
machine
itself. So basically what you're offering here is a non-estrogen, obviously, approach to vaginal dryness, vaginal irritation, painful intercourse, for certain indications of painful intercourse, that women can do with a short procedure in the doctor's office and basically no recovery.
That's correct.
Now, you had said that it takes more than one treatment.
Yes, the current regime is 3 treatments about 4 to 6 weeks apart.
And it takes, you said, that the results last for approximately 1 year.
Right. Now, we haven't done prolonged longitudinal studies, but based on the Italian data and our preliminary data, it seems that the success is still fairly durable at a year, may start to slip off, and at that time when the symptoms start to recur, we just recommend 1 treatment.
I see. And at the present time, this is not covered by insurance.
That's correct.
And
it's an out-of-pocket expense.
And that would be how much?
In Cincinnati, we charge $600 a treatment, so a total of $1,800 for the 3 treatments.
So this is an alternative to women who are seeking help from vaginal dryness, irritation on the skin around the vagina, painful intercourse, looking for a non-estrogen alternative that is relatively easy to do in the right setting and lasts for about a year.
That's correct.
Anything else you'd like to add?
No, I think that's it.
Thank you very much.
All right.